Hello, my name is Adam Smith Connor of New Forest Physiotherapy Clinic, and today I'm going to be talking about shoulder injuries, specifically rotator cuff impingement syndrome. So it's important to understand the anatomy of the shoulder and the rotator cuff muscles. So the shoulder is a joint between the humerus, the head of the humerus here, and the glenoid here of the shoulder blade. And holding it in place, we have a labrum, which is a cartilage rim that goes around the edge of the glenoid. Now, the shoulder joint is not like the hip joint. The hip joint is a very stable joint. It's a ball and socket joint. But the shoulder joint, in terms of the bony structures, is quite an unstable joint. It's more like a golf ball on a tee. And giving a bit of extra stability, we have a rim of cartilage around the edge of the glenoid here, and muscles that hold it in place. And these are the rotator cuff muscles. So the main rotator cuff muscles that we have at the top here, we have supraspinatus, which is at the top of the scapula, comes through the space at the top of the scapula. Let me just turn so you can see this more clearly. There we go. So it comes through this space at the top of the scapula, attaching onto the head of humerus, providing stability here. Then we have subscapularis, which is here underneath the spine of the scapula, and that comes and attaches at the back of the head of humerus. And on the front, if I just turn my skeleton around here, at the front we have subscapularis here, which comes from underneath the scapula and attaches at the front of the head of humerus here. So those all clasp around the head of humerus, helping to hold it in position. So just to recap, we've got supraspinatus at the top, infraspinatus underneath. I think I might call that subscapularis. It's not. It's infraspinatus underneath the spine, and subscapularis here at the front of the spine. Those all work to hold the shoulder in position. And on this shoulder we can see them here. Also, you have the ligaments of the capsule around the actual joint, and that also helps to hold it in position. The shoulder is very mobile, lots of mobility, but because it's very mobile, it also means it's less stable and therefore more prone to dislocation. But I'm not talking about dislocation today, we're going to talk about impingement. So, impingement is when the usually supraspinatus gets pinched in this space here. So the supraspinatus we can see on the skeleton here. It's if I just turn him around again, you can see it better from the rear. There we go. So it comes from above the spine of the scapula and through this space here, move that down, through the space attaching at the top there. So when we lift our arm up, this is the tendon coming through here. We lift the arm up, what can happen is that tendon gets pinched in that space. Now, there's different ways that can happen. It can happen traumatically, so you fall, or you're in the gym, you lift something too heavy, you overstrain it in a very obvious way. But more commonly, it's a degenerative thing over time. So maybe you're a builder and you're working overhead and you're doing this sort of thing for many hours a day, and it just cumulatively builds up. And what can happen is the tendon here gets a little micro trauma, tiny little tear, not enough you really notice it, but that builds up and it builds up and it builds up over time. and then you get a thickening of that tendon. So what happens once it's thickened and swollen, when you lift your arm up, this tendon sort of retracting, pulling the arm up, and it gets pinched in this space here. And that can be very painful. Classic tests for that are something we called two really, Hawkins and the empty can. So if you hold your arm up in this position and then someone pushes down, that can be painful, or laterally rotating can be painful, or in this position, pushing down, that could be quite painful. When you lift the arm up to the side, we get a painful arc. So we come up, it's not painful, not painful, ouch, 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 it's painful, painful, and then it gets easier again. And then on the way down, not painful, ouch, painful, 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 and then it eases again. So you end up with a painful arc. So, and the other test is empty can. So it's called empty can because imagine you're emptying a can, watering the plants, that movement, okay? And what that does, it pinches on the tendon. Thinking of the anatomy, so the head of the humerus here, you've got a bulbous part on the head of the humerus, or a trochanter. As you lift up, that will pinch in this space or reduce this space. Whereas if you rotate it, it won't rotate very easy on here, but if you rotate so that your thumb's up, so you're rotating your arm thumb up, you can lift up and it's pain-free. But if you've got your thumb, just move them out of the way. So if you're lifting up thumb up, you're opening up the space in the shoulder so you can lift up, and that might be pain-free. But if you do it thumb down, it will be more painful, or thumb level, it will be more painful because you're reducing the space for the tendon to move. Now, treatment for a shoulder impingement is to do friction massage, ultrasound, which you would have to go to a physiotherapist for, and rotator cuff exercises. When we first press on that tendon, it can be extremely tender when we first start the sessions, but after 6, 7, maybe 8 sessions of intervention, friction massaging across that tendon and ultrasounding it, that tenderness will reduce over time. And if you did an ultrasound scan on the tendon, initially healthy tendon tissue looks like uncooked spaghetti in a packet. So all the fibers are lined up like an unopened packet of spaghetti. Scar tissue looks like cooked spaghetti on a plate. So all the fibers are kind of jumbled up and broken up. And that is scar tissue. And what happens is we're going to press on that thickened, jumbled up spaghetti, pull it apart with the friction massage. The ultrasound is like a heat treatment that helps to promote circulation and promote healing. And we use that to accelerate the healing process. And then the exercises, which I'll show you in a moment, put stress through the rotator cuff muscles, telling the fibers how to line up to heal the tendon. So tendon will and tissue heals itself along the lines of stress. So the exercises that you do, the rotator cuff exercises that I'm going to show you in a moment, are really important to tell the body how to heal itself. So rotator cuff muscle exercises are really important for shoulder impingement syndrome, as I've already explained. So TheraBand comes in different colours and resistances. I've got a green one here, which is kind of an intermediate. Yellow is easy. Blue and black are far harder. So when you first start doing these, get a yellow, an easy one, and then gradually build it up. So it's useful to have a wedge to put underneath your elbow, like so. Put the band over a door handle or some sort of secure point, and then keeping the elbow tucked in, you just rotate outwards, like so. And this one will work infraspinatus, which does lateral rotation of the shoulder, keeping the elbow tucked in. So the reason for this wedge is if I don't use the wedge, like that, there's a temptation when I pull out to pull my whole arm out, okay? So by using the wedge, it prevents my whole arm from coming out. But you could do it without, just as long as you remember to keep it tucked in. Then I would turn around. I won't turn around for this because you'll have my back to you. But then you can do the opposite arm. So swap arms. And pulling in. And this one's more subscapularis. Rotating inwards. If I move out a bit more, I'll get more of a movement. And if I tighten this up a bit, I get more of a movement. Pulling in. Rotating in. Okay. Rotating in is a stronger movement than rotating out, so you could possibly double it up to pull in. Okay. Like that. Next one is for supraspinatus, which is the one that most commonly gets injured. So I'm going to stand on the end of the band, just below, out of camera shot. So I'm just standing on the end, and then I'm going to lift out up to the side. Now, when you first start doing this, you might find that you can only go up to here before it becomes painful. I don't want any of these exercises to be painful. Maybe a little bit of discomfort, but that's it, okay? But as you get stronger and as the scar tissue reduces, you'll be able to go further into the movement, okay? If you can go all the way up, go all the way up. And when I say all the way up, you need to lift your arm right the way up to your ear and back down, okay? And that's going to really work supraspinatus. Now, sometimes it's too painful to do it directly out to the side, in which case you can do it to the front. It's always worth doing to the front as well anyway. If I just turn sideways, there you go. So just coming up to the front, like so. Okay, other important exercises to make sure you maintain the movement in the shoulder is to stretch the tendon. And a good way of doing that is you put your hand behind your back and you just stretch, use your good arm, just stretch up as far as you can. Okay, and then another one to keep the movement, put your hand behind the neck and just stretch down behind the neck. So those are rotator cuff exercises to help improve supraspinatus impingement. The exercises alone probably won't be enough. I mean, try them, but you may well find that you need to have the actual intervention of massage and ultrasound. Another good treatment, I don't provide it here at New Forest Physio, but shockwave therapy can be very effective at breaking up scar tissue as well. So if you've got a shoulder impingement, we can certainly help you. I'm based in Marchwood, and the phone number's 023 8008 9120, or look us up on the internet. That's newforestphysio.co.uk. I hope that was useful to you. God bless and goodbye for now.